Hello guys, in this video we'll be talking about the general pharmacology. So how can we make general pharmacology easy? So we will be discussing easy mnemonic for the same. What are the graph based question that can be asked from your USMLE first aid, how to integrate with it, and what are the easy mnemonics that will help you remember it. So this is important for all the exam going aspirant, whether you are for NEET, PG, INI seat, FMG, USMLE, or even for your college exams. So this will help you in toto. So let's get started with the general pharmacology. So before we get started, we will read some of the mnemonics first, and then we'll revise it again at the end so that we don't get confused, because making mnemonic is easy but to remember it is again a difficult task. So I'll try to make mnemonics from the name so that it becomes easy. First of all, drugs with high first pass metabolism. So remember, nitrates have a very large pre-systemic metabolism. So if you remember like this, and nitrate have means hydrocortisone, which is a steroid. L means lignocaine. Very means verapamil. P means propranolol, which is a beta blocker. S means salbutamol. And metabolism, M for morphine. So which are the drugs which are frequently asked? This lignocaine, this nitrates, and this morphine. These are the drugs which are frequently mentioned in your option. So they have a very large pre-systemic metabolism. Now coming on to the some drugs that are highly plasma protein bound. So one thing that you need to remember, if the drugs are highly bound to plasma protein, means they will distribute less in the tissue. As a result, these drugs have a low volume of distribution because they are highly bound. So what is the mnemonic? Remember the mnemonic. Warfarin displays very high very strong protein fixing plus binding. Okay, so like what was the mnemonic for that? That nitrate have a very large pre-systemic metabolism. So here the mnemonic is warfarin displays very strong protein fixing plus binding. So warfarin, that is diazepam, that is benzodiazepine. Very means valproate, that is anti-epileptic. Sulfonylurea, that is a anti-diabetic. Then phenytoin, again anti-epileptic. Then you have fluoxetine. Then you have penicillin, antibiotic. Then you have barbiturate. So these are the drugs which are highly bound. So what are the things that get frequently asked in the question? This is barbiturate, that is frequently repeated. This is sulfonylurea, and this is warfarin and diazepam. These are some frequently repeated drugs. Now coming on to the significance of plasma protein binding. So if the drug is plasma protein bound, okay, so drugs which are high plasma protein bound are long acting. First D is for duration, then distribution. Drugs which are highly bound, they will stay in the plasma, hence low volume of distribution already done. That means VD decreases. VD is the volume of distribution. A high plasma protein bound drug can displace another high protein plasma. Means the important thing is that questions on interaction may be asked here. So this is important. Then dialysis. Drugs that have high plasma protein bound, they cannot be removed by dialysis. Okay, because they are more because they are more in the plasma, less in the tissues. Okay, so they cannot be removed by dialysis. Now coming on to the other mnemonic, because we read just now dialysis. So what are the drugs on which dialysis is ineffective? So remember the mnemonic dialysis co avoid. Okay, that is if you remember dialysis co avoid. Dialysis means diazepam. Co means kerosene. In kerosene poisoning also we avoid the dialysis. Then avoid. A for amphetamine, V for verapamil, then O for organophosphates and opioids, I for imipramine, and D for digitalis. So these are the important drugs in which dialysis is not effective. So it can be asked as an MCQ question. All of the following drugs dialysis is effective except. So if you remember the mnemonic, it will help you. So dialysis co avoid. So we have most of the mnemonics from the name you can see. Now what are the names of prodrug? Okay, so either you can remember this mnemonic, all prefer doing MD in clinical subject, or you can remember this mnemonic, CCD sells coffee. For me this mnemonic, I feel like this is more relatable, so I remember this one. CCD sells coffee. C for carbimazole, that is the anti-thyroid drug. Then you have carisoprodol, no need to remember, not important. Then you have dipivefrin. Then spironolactone, which is a diuretic. Okay, that is a potassium sparing diuretic, we will cover in some other time. E for enalapril, which are used in antihypertensive. ACE inhibitors and ARBs wala drugs category, ACE inhibitor. Then you have levodopa, which is used in Parkinson. Then you have lovastatin, that is HMG CoA reductase inhibitor. Then S, that is simvastatin. Then coffee means cyclophosphamide. Okay, so these are other drugs. And cyclophosphamide, what is the most important side effect, if you can recall, guys? That is hemorrhagic cystitis, and the treatment is mesna. So this is one of the most important and frequently asked question. So remember, all of these ACE inhibitors, okay, they are prodrugs. Okay, these ACE inhibitors are prodrug, okay, except two things, that is lisinopril and captopril. So how can you remember? Remember lice in the cap. Okay, so these are not prodrug, these are already active. So lice in the cap, that is lisinopril and captopril. This question was asked in this year exam. So this all are very important question that is repeated again and again, so you need to remember these questions. Now coming on to the microsomal enzyme inducers. Okay, so what are the microsomal enzyme inducers? Okay, so we have the mnemonic, that is GPRS cell phone. Okay, G for griseofulvin. Can you recall, guys? This is an antifungal drug. Then phenytoin, again an anti-epileptic. R means rifampicin, that is used as an anti-TB drug. Then S, that is smoking, which contains nicotine. Cell phone, C is carbamazepine, and P for phenobarbital. So this is important, guys. Okay, so this is microsomal enzyme inducer. Now coming on to the microsomal enzyme inhibitor. This is a mnemonic. I think if you like it, you remember. Otherwise, in the end, we have one more mnemonic, that is sick faces. That makes it more easy. So I don't remember this one. Now coming on to the substrate of CYP3A4. Okay. So basically, these are the name of drugs that are metabolized by this enzyme. So the mnemonic is CT scan. Okay. C for cyclosporine, and C for calcium channel blocker. T for tacrolimus, okay, which is an immunomodulator, and T for terfenadine, okay. S for statins, like which are lipid lowering drugs. Then you have cisapride, mozapride wala category drug. Then for A you have amiodarone, okay, which is again an anti-arrhythmic drug. Then N means Navir, which is a protease inhibitor. Can you recall some protease inhibitor like lopinavir? Then you have ritonavir. Okay, so these are some of the protease inhibitor. So when you try to recall a drug, please try to recall name of the category nearby. In exam, this may also help you to rule out the option. So try to name. I know reading pharma is a bit difficult, but try to recall. Now coming on to the drug metabolism. Okay, so see, there are phase 1 reaction, there are phase 2 reaction. Okay, so phase 1 reaction, the most important, that is reduction, oxidation, hydrolysis. Okay, so these three are the most important reaction. Then in phase 2 you have acetylation, glucuronidation, few more reaction. Okay, so now coming on to the what are the drugs that undergoes glucuronidation and what are the drugs that undergoes acetylation. So remember the mnemonic SHIP-D drug. Okay, so S for sulfonamide, H for hydralazine, I for isoniazide, again anti-TB drug, and P for procainamide. Okay, and D for dapsone. Dapsone is a drug used for leprosy. It is a dihydrofolate reductase inhibitor. Now coming on to the glucuronidation. So mnemonic is D-clamp. Okay, so a question may be asked, all of the following are metabolized by glucuronidation except, then anything other from this. C is chloramphenicol, L means lorazepam, A for aspirin, M for morphine, and P for pethidine or piroxicam. Okay, so these are the drugs that are metabolized by glucuronidation of phase 2. Now remembering therapeutic drug monitoring. If you see the name, what does this mean? Means therapeutic drug which has a low therapeutic index. Okay, so therapeutic index, if you talk about what is the meaning of therapeutic index? See, you have this. Okay, that is lethal dose 50 by effective dose 50. So the mnemonic is TILE. Therapeutic index is the lethal dose 50 by effective dose 50. So these drugs have a low therapeutic index, means it can cause toxicity very soon. So you need to monitor it. So what is the mnemonic? A drug possessing low therapeutic index. A for aminoglycosides. So can you recall some of the aminoglycosides like gentamicin, tobramycin? What is the side effect of aminoglycoside? N for nephrotoxic. Okay, the in name NO comes, and O for ototoxic. So these are the most important side effect of aminoglycosides. Okay, then drug that is digoxin, P for phenytoin, L for lithium, a drug which is used in mania. It has a very low therapeutic index. Then TCA, that is tricyclic antidepressant, and I for immunomodulator like cyclosporine. So this is important. Now see, when will you do therapeutic monitoring? See, when they have a narrow therapeutic index, obviously the concept is this only. Okay, when it is difficult to monitor, like if you have some drugs like antihypertensive medication, so it's very easy, put a BP cuff and check. So you do not monitor, you do not do for drugs like anti-diabetic and it's very easy to take a blood sugar, just put a pinprick and take the blood sugar. Antihypertensive, very easy. So it is done for anti-epileptic. Every time taking a ECG is not possible. Every time checking for the brain is not easy. So it's not done for prodrugs. Okay. What was the mnemonic for product? That was CCD sells coffee. Okay. So that is not done. Now hit and run drug. So what are the meaning of hit and run? The mnemonic is MOGRA. Okay, we'll be seeing. Okay. See, this we have already done. Drugs causing SLE, SHIP drug. Okay, we have already done, guys. Now, drug-induced hemolysis in G6PD deficiency. If you recall my biochem lecture, I've already said about the G6PD. This is enzyme that is glucose 6-phosphate dehydrogenase. So what happens when you have any stress? When you have drugs like primaquine, or when there is a faba bean wala thing, okay, you recall there is a hemolysis, so that causes drug induced. So here it may be also due to drug induced, so that may be due to primaquine. See, already done anti-malarial drug. Then isoniazid TB drug that can again cause G6PD deficiency. Then you have nalidixic acid, okay. Then you have sulfonamides, again antibacterial agent. Then you have menandione, okay. Then you have chloroquine. Then you have quinine. So these are the drugs that may induce hemolysis, okay. Now see, coming on to the important concept. See, this is the question that is most frequently, if you ask something that is most important in this chapter, is this concept. How do you treat acidic drug poisoning and how do you treat basic drug poisoning? So remember, acidic drug, okay, when two people of opposite thing meet, then only something will happen. So if the drug is acidic, okay, we need to make it to go to a basic person, okay. When two opposite gender mean tabhi kuch acha hoga. That is, we need to take it to opposite. So we'll go with basic. So we need to alkalize the urine. So how do you use? That is bicarbonate. So we can use either sodium bicarbonate or acetazolamide. That is the that is used to alkalinize the urine. Now coming on to the basic drug poisoning. So basic will do good when it goes to acidic people, because two opposite thing attracts, two opposite pole attract. So here basic we need to acidify the urine. That is, we can use ammonium chloride, that is CH plus, NH4 plus, vitamin C, ascorbic acid, other name. So in name only acid is coming. And you have cranberry juice. Okay, this cranberry juice also helps to acidify the urine. So what are some acidic drug? That is aspirin, barbiturate and methotrexate. Okay, these three are the acidic drugs. And when you have basic drugs like amphetamine, okay, that is, you need to acidify the urine. Okay, that is important. Now see, coming on to this first aid wala thing. What does first aid writes for you, and what are the things option that can come for your exam? See, what happens when you use one acid and one base, okay, so there happens the ionization. And when ionization happens, it's very easily excreted out in urine. The aim is only this. See, ionized species are trapped in urine and they are cleared quickly. That is important. So what are the examples of weak acids? See, phenobarbital, methotrexate, aspirin. Do you see? So they are trapped in basic environment. So we need to make the urine basic. How we will do? By using either sodium bicarbonate or acetazolamide. So this is important. Now coming on to the weak bases. What was the weak bases wala thing? That is amphetamine and TCA. Okay, so they are weak bases. So amphetamine and TCA, so you need to trap in acidic environment. So it is treated with sodium bicarbonate. Okay, they are weak bases. Okay, so you need so they are weak bases. So you need to go to the acidic environment. This is important. Okay, so this was about your amphetamine and TCA wala thing. You can use ammonium chloride, NH4Cl. You can use vitamin C. You can use cranberry juice. Okay, now coming on to pKa. So what is pKa? pKa means the pHs, which 50% of the drugs are ionized and 50% is not ionized. So this is about the pKa. Okay, so if you increase the pKa, it goes towards more basic, and if you decrease the pKa, it goes towards less acidic. Okay, so that is, if you decrease the pKa, it goes more acidic, and if you increase, it goes more basic. Now coming on. Now coming on, so this is taken from Arpit's notes from his Telegram group. This way very good for revise, so I took it from there. Okay, this is from Dr. Arpit sir. Okay, now coming on to the first order kinetics and zero order kinetics. See, remember, first order kinetics, that is first, means first order, a constant fraction of the drug is eliminated. It's independent of the amount of the drug. Suppose I'll take an example, guys. Okay, suppose the amount of drug was 100. Okay, and the t half of drug is 30 minutes. Okay, so what will happen after 30 minutes? This drug will become 50. Suppose if you take now the drug in the concentration of 500, again after 30 minutes it will become 250. That is it's the same fraction is eliminated in 30 minutes. The half, it becomes half, that is same fraction. In zero order kinetics, here same amount of drug is eliminated in zero order. Okay, so this is a straight graph. Okay, so so here the clearance and t half are a constant. Okay, because the formula for first order, I think if you can recall, that is 0.693 by k, if you can recall, and here the formula is t half is equal to a naught by t 2k. Okay, so this is important. So this was your first order and the second zero order kinetics. So now what are the drugs which shows you first zero order kinetics? So remember the mnemonic 0 watt power. In order to help you remember, that is 0. W for warfarin, E for alcohol, T for theophylline, and T for tolbutamide, and P for phenytoin. Now coming on to the hit and run drugs, where we did not require therapeutic drug monitoring. So they have a short T half, okay, but this have a long duration of action. Even when they leave the body, but they act for a long time. So you have MAO inhibitor, that is monoamine oxidase inhibitor. Then you have PPIs like omeprazole. Then you have drugs like guanethidine, then Rasparin and aspirin, whose only antiplatelet effect is there. Okay. See, now coming on to the transdermal patch example. Okay, so some drugs are there in which you apply a patch. So remember the mnemonic transdermal. You can remember in the name only if you see RNS, that is R for rotigotine, which is used for Parkinson disease. Okay, others like levodopa, carbidopa, other also used for Parkinson. Then rivastigmine. So what are the other drugs for Alzheimer, guys? Recall with me: donepezil, rivastigmine, galantamine. So rivastigmine is a transdermal patch. Nicotine for smoking withdrawal. Okay, nitroglycerin and TG, that is used for angina. S, that is salicylene, that is used for depression, and scopolamine, that is used for motion sickness, which is a frequently asked MCQ, PYQ. So this is important. Now coming on to the competitive antagonist and non-competitive antagonist. So remember, see, competition. So what happens in competition? In order to sustain in the competition, okay, you need to work hard. Okay, so there is a rightward shift in the competition. Okay, so this is about the competition. Example is carbamates on choline esterase, that is competition. Organophosphate on choline esterase, how will you remember? Competition. Okay, carbamates on choline, organophosphorus on choline. I think you can remember like this. Non-competitive. Okay, when you don't compete, when you think you are the best, you will go down in your life. So there is always a scope for improvement for everyone. That is, when you here in competition, when you do competition in the right direction, you go. Okay, see, right direction competition. Okay, non-competitive, guys. So how do you remember non-competitive? Remember no change in Km. Okay, like this you can remember. So here no change, so here the Km will change. That is, competition will increase your Km, but the Vmax does not. See, the maximum is the same thing, guys. Okay, here the Vmax decreases, guys. Okay, if you don't compete, your Vmax will decrease. Okay, and Km has no effect. Now non-competitive, what is the mnemonic? Example, acetazolamide on carbonic anhydrase and ferrochelatase inhibition by lead. I think you can recall this in your heme lecture when we talked about the porphyrias. We have already discussed this, I think, if you can recall your heme lecture of biochem. Now coming on to important topics. What is efficacy and what is potency? See, name says efficacy. Kitna drug efficacious hai. That is how much the maximal effect a drug can produce. Okay, like if you see, this is drug A, this is drug B. So which drug is more efficacious? If the question asked, this was the question, this type of question, similar question was asked in your INI-CET 2022. Okay, so which drug is more efficacious? If you check it out, guys, so drug A has more, drug A goes more up, it produces more maximum effect. See, drug A goes till 100, but this goes only up till almost 48, means A has more efficacy. Now potency means kitna amount chahiye, how much amount is needed to produce that effect. Okay, so suppose here we take the maximum effect as 50, we want the effect is 50. So if you see drug A, this produces in this much concentration, but this drug B requires more amount to produce the same effect, guys. Okay, that is drug A is more potent, though the efficacy of both the drugs here are same, but this drug A is more potent. Okay, so this is important. This line may also be asked as a true false question if they ask you like this partial agonist have less efficacy than the full agonist. Partial kam karega, but full it will do the maximum work. So efficacy, maximum amount, maximum effect will reduce with partial agonist. Now see, we talked about the competitive and non-competitive inhibition. So there are two graphs that may be asked. That is, one is the Michaelis-Menten kinetics and one is the Lineweaver work plot. This is important both from pharma aspect and also this encompasses your biochemistry aspect. There also, when you have enzyme inhibition, they ask you this graph. Okay, see. So what is this Km? Okay, this Km is inversely related to the affinity. Okay, and this Vmax is directly proportional to the enzyme concentration. This is important. Okay, see here, what is the graph for hemoglobin? You have a sigmoid shaped curve. Okay, this is important. This frequently get asked, where will the graph shift? Okay, so when you see competitive and non-competitive, see recall non-competitive, no change in Km and the Vmax gets decreased. If you talk about the competitive inhibitor, okay, so the Km gets increased and the Vmax gets unchanged. Okay, so this is about the competitive inhibitor, which is reversible wala competitive inhibitor. So see, when you have competition that is reversible, so someone is trying to compete you, but with your hard work you can be still at that place. That is, it can be overcome by increasing the substrate. Okay, now competitive inhibitor in irreversible means this guy is trying to compete you but not fairly. Okay, he's trying to do like back bitching backward. Okay, that is, it cannot be overcome by your hard work because he's not trying to play fair in the game. Okay, both of them are trying to bind to the rank 1, that is your active site. So try to understand like this. Now coming on to the Lineweaver work plot. Okay, see, the competitive inhibitor increases the Km and non-competitive inhibitor, there is no change in Km, guys. Okay, so this is about, see, and how can you recall this graph? This competitive inhibitor graph, competitive crosses. Okay, so when you are good in competition, when you are trying to behave compete nicely, so you will cross and go ahead. That is competitive crosses. Non-competitive do not cross. Person who are non-competitive think he is the best, he won't go ahead in life, so he won't cross. Okay, now coming on to some other terms that may be asked, or the graphs that may be asked. See, bioavailability. So bioavailability means it is the amount of drug that reaches the circulation. Okay, so suppose you are giving the drug IV, means it is directly going to the veins, matlab entire amount will reach. So the bioavailability is 100%. Even this is asked as a PYQ. You can think like we can make examiner think we can make so easy questions and mistake that they even ask this question, guys. So when you give orally or by some other route, guys, okay, so the first of all absorption will be less and it goes to the liver where happens the first pass metabolism. So bioavailability is defined as area under the curve. This is important again. Now coming on to the volume of distribution. So this volume of distribution basically is the theoretical volume, guys. Okay, that will tell the total amount of drug in the body relative to the plasma. See, so if the volume of distribution is low, means drug less distribute ho raha hai. It's not distributing. Why? Because it is highly plasma protein bound. If the drug is distributing very high, means it's less plasma protein bound, but it's more tissue protein bound. Okay, now clearance. So amount of plasma cleared per unit time, that is the clearance. Okay, so this is the clearance wala thing. Now T half. So what does name T half? Time taken in order to decrease to 50%. Okay, so that is T half. So in a first order kinetics, see, this is an example of first order kinetics. Okay, so what happens in a first order kinetics? Try to understand. First order kinetics, every time it becomes half. Suppose we take an example of 100. After 30 minutes 50, after 30 minutes 25, after 30 minutes 12.5, after 30 minutes 6.25. means with every passing T half, 1 T half, 2 T half, 3 T half, 4 t half. Okay, with every passing t half it decreases. Okay, so when you pass 4 to t half, 5 t half, it reaches a steady state. So this is also a PYQ. Okay, it takes about 3.3 t half. Okay, to reach about 90%. Okay, so you see, when you take 3 t half, guys, okay, that is 87.5% has gone. Okay, and if you take like more than 3.3, that is more than 90% will go. So this is only what they are trying to explain you. Then you have loading dose ka formula, that is target plasma concentration into volume of distribution by F, that is bioavailability. This is important. See this line, this is very important. Time to reach steady state, okay, it depends on your t half, not on your it is independent of the dose and the dosing frequency. This is important. Now coming on to some drug effect modification. So there are some terms like additive, means you add 2 plus 2, that is 4, that is addition. Synergistic means 2 plus 2 instead of being 4, synergy, they are working together, means it will be more than 4, like clopidogrel with aspirin, which is used for prophylaxis of stroke and other things. Now potentiation, okay, it is similar to synergism, okay, but drug B with no therapeutic action enhances the therapeutic action of A. Okay, that is carbidopa. So what does we put a combination of carbi plus levodopa. Okay, so what does carbidopa do? Okay, it blocks the peripheral conversion of to dopamine, so that there is an increased availability in the CNS, that is potentiation. Antagonist, okay, so effect will be less. Okay, like ethanol is the antidote for methanol toxicity, like for paracetamol toxicity, it is N-acetylcysteine. Now tachyphylactic. So tachyphylactic, when you give repeated administration, instead of doing good, it will act opposite way, like oxymetazoline, which is a nasal decongestant. Okay, when you use again and again this congestion, there is a rebound congestion. So this is about. Now see the example. We have one drug A, we have one drug B. When there is an addition of the two effect, that is additive. When the effect is much more, that is synergistic. That is important. So tachyphylactic, there is acute decrease in response when you do repeated administration. That is like lysergic acid, diethylamine, ecstasy, MDMA. These are the drugs like which causes dependence wala thing. Okay. So the zero order, first order, we have already discussed. This is the graph for zero order, that is constant, and here in first order t half is independent of concentration. Okay, so whatever be the concentration does not matter, same fraction of drug will get eliminated. See, when you give initially in the start, the drug follows the first order kinetics, but when the enzymes get saturated, it switches to zero order kinetics. Okay, see this drug urine pH and urine metabolization has also this phase 1C. We have seen there is reduction, oxidation, hydrolysis, cyclization and decyclization. Now coming on to the phase 2. So phase 2C, we read two mnemonic, that was declam and CYP-D wala things. Okay, so there is remember phase 2 we have methylation, glucuronidation, which we have already done, acetylation, CYP-D wala drug, and sulfation. So what are the things that are important, guys? Okay, so when you have a problem in acetylation, there is a reduced glucuronyl transferase that is seen in Gilbert syndrome, which is a type of unconjugated hyperbilirubinemia. Put in comments, guys, what are the two examples of conjugated hyperbilirubin. Okay, so Crigler-Najjar syndrome. Glutathione ka insufficiency may cause acetaminophen toxicity, and slow acetylators, okay, they can cause drug induced SLE. These all things are important. See, coming on to this inducer wala mnemonic. Okay, we won't read this mnemonic because it's more tough. Okay, that is GPRS, new cell phone. Okay, so G for griseofulvine. Okay, P for phenytoin, P for phenobarbital, R for rifampicin. Okay, S you can remember smoking nicotine, or S for scent zone. What? New, that is nevirapine. Okay, then cell phone, C for chronic alcohol abuse, C for carbamazepine, and P for phenytoin or phenobarbital. Okay, so what are the substrate that interact with it? Remember O what means why am I interacting? O for OCPs, W for warfarin. Okay, then you have A for anti-epileptic and T for theophylline. These are the drugs which frequently interact. Okay, so these are important. Now inhibitors, if you see, so the mnemonic is sickfaces.com. When you are sick, you like having grapefruit juice. Or also you can see most of them have no in their name. See, isoniazid, then you have ketoconazole, fluconazole, then see you have like here you have sulfonamide. Do you see metronidazole, amiodarone? So sick faces. S for sodium valproate, I for isoniazid, C for cimetidine, K for ketoconazole, F for fluconazole, A for acute alcohol. So chronic alcohol is a inducer, okay, but acute alcohol is a inhibitor. Then C for chloramphenicol, E for erythromycin, S for sulfonamides, okay, common ciprofloxacin, omeprazole, metformin. Remember, like most of the things which have no wala things are basically inhibitors. Now see this we have again done. This is a simple thing which we have done. Now coming on to the other important thing, that is receptor binding. Okay, how does graph shape? When you have competitive antagonist, when you have non-competitive antagonist, and when you have partial agonist. Okay, see, when you have a competitive antagonist, okay, so when someone is trying to oppose you by competition, so you need to work hard in order to achieve the same thing. Okay, so the amount that yielded you previous result won't yield you now, so you need to work more out, so the potency will decrease. Okay, the means the amount will increase of hard work, so the potency will decrease, and efficacy you will have no change. Okay, because effect will be the same. It can be overcome by increasing hard work, agonist consent. Example, diazepam and flumazenil. Okay, that is important. The non-competitive antagonist. Okay, so this person is silently trying to oppose you. So here efficacy will decrease, guys. Okay, because you are not knowing who is trying to oppose you, so your efficacy will decrease. Okay, and it cannot be overcome by your hard work. So now partial agonist. So here the potential is independent, but efficacy decreases in partial agonist. Example, morphine plus buprenorphine on mu receptor. See, this therapeutic index has also been already discussed. The mnemonic is style, that is therapeutic index, lethal dose 50 by effective dose 50. This is, guys, all you need to know about your general pharmacology. I hope this helps you memorize general pharmacology. I will be sending across the PDF, guys. Revise with the PDF. This will help you remember for a lot of time. So, and try solving the MCQs from whatever source you do. Hope this helps you revise the general pharmacology. Best of luck. Happy learning, guys.